Live on Zoom. Mentorship series. SQWM. And copy and paste this. All right, we are about to go live.
Good luck, everyone.
Okay, preparing for Facebook Live. Sorry, it takes a second. Okay, it says it does not exist. Strange. On a page. All right, we're now live on Facebook, and I'll let the folks in right now. Okay, everybody is here as far as participants. Take it away, Paveena.
Okay, thank you, Ariel. Hello, good evening, everyone, and welcome to our third session of our South Queens Women's March Mentorship Series. I will be your moderator tonight. My name is Paveena Rewah. I am an HR professional, and I'm also a member of this wonderful organization, the South Queens Women's March. So tonight our focus will be medicine and sciences, and I have a wonderful group of panelists for us to hear from tonight. They will be focusing on areas of medicine in various industries and across various institutions. So I will now turn it over to our panelists. We have Christina Motilall, we have Shakti Ramsamooj, we have Gurdeep Gorga, we have Harmehar Kohli, and we have Deborah Doodnauth. And Christina, why don't you go ahead and introduce yourself?
Sure. Thank you so much, Paveena. Hi, everyone. My name is Christina. I am a team lead for the U.S. and Caribbean markets for Amboss. Amboss, we're a global medical education company specializing in medical platforms for medical students and physicians. I'm also a South Queens Women's March member. I'll pass it over to Deborah.
Hi, my name is Deborah. I am an oncology pharmacist at a large academic center in the New York City area. I am also a member of South Queens Women's March, and I will pass it off to Shakti.
Hello, thanks again, Paveena, for the introduction. My name is Shakti Ramsamooj. I am a second-year PhD student at Weill Cornell Medicine, which is a subsidiary of Cornell University, but it happens to be in the city, so I'm still within the New York City area. Also a recent South Queens Women's March member, and as of now, my PhD is in the field of biochemistry, but and I can further describe this process for anyone who's interested. It's kind of, it gets more detailed. Thank you.
Yeah,
sorry.
Good evening. My name is Gurdeep Gogna. I'm a medical student approaching the end of my medical education at American University of Antigua College of Medicine, and I'm also a South Queens Women's March member. I can pass it on to Harmehar.
Hi, good evening, everyone. My name is Harmehar, also go by Mayher. I'm currently a first-year resident in internal medicine at NYU, and I am one of the founding board members of South Queens Women's March.
Awesome. Thank you so much for your introductions, ladies. We are very lucky to have a panel of women, so go us. So the first question that I will be posing to you all is, what has inspired you to pursue a career in medicine and science? And Christina, you can start it off again.
Yeah, I was waiting for anyone who was very eager to go ahead and that's a great question. I think we all go into medicine, or sometimes a lot of fields where it's patient facing, thinking that you want to save or help the world. I definitely had those thoughts where I just want to help everyone. But to get more in depth on it, going particularly in a career of medicine and science, it's really demanding. It requires a lot of hard work, a lot of dedication, and you should go into it because you've seen a lot of things that maybe were unjustified or things that you didn't like in the world. For me in particular, it was seeing a lot of family members back home in Guyana who were dying of things just as simple as diabetes, which can be easily treated in the States by taking insulin, taking their medication, and like heart disease, just simple little diseases that they're passing away from. So as a person of color, you want to go into medicine thinking that you can change policies, you can change medicine as a whole and making it more acceptable for people to like trust medicine, because that's not easily trusted in our communities. So that was one of the main things that made me go pursue medicine and sciences.
Shakti, would you like to go next?
Sure. Yes. So I always had an interest in, I think, science within school, but I feel like I wasn't shown a lot of career paths sort of associated besides medicine, and I still very much think medicine is amazing, and I hope to make it a part of what I do. But in my own experience, I always erred on the side of the laboratory, and like as I went through college and I was a biology major, I really liked those opportunities, and I had the great fortune to also work with a faculty member in their laboratory. And I found that that really piqued my interest, and I saw it as another way I could sort of also approach medicine and science and possibly make some sort of contribution at a different level. So it's kind of very related to medicine, or it can be, or I'm still figuring it out, but I think I found something very exciting, and I think it was basically experiences in laboratories that informed that decision.
Gurdeep?
So initially, my journey to medicine began with a keen interest in the dynamic connection between the mind and the body. So I was always fascinated by how the human body functions, but more so what inspired me was the opportunity I'd get with medicine to bring positive change in people's lives. So I think my inspiration was kind of studying more of like mental health and figuring out how specifically mental health directly affects like physiological functions of the body. And so I went on to pursue medicine.
Behar?
Yeah, I think this is always a great question. And for anybody interested in medicine or the health sciences, this is a question you will be asked every year, at every interview. And I think it's so interesting how much it evolves, because medicine is something you have to wake up and choose and feel satisfied with every day, because like Christina mentioned, it can be extremely demanding and there can be really hard days, and you have to, I think, constantly keep asking yourself this question. And now as a resident, I think what one day, like earlier, was like wanting to help people, and this very glorified thought when I was younger has really turned into me realizing what a privilege it is to be a part of some of the most intimate moments in people's lives. And I think I saw that at a young age too, that, you know, every job is important, but there's something so interesting, but also weird about being a doctor, that you create a level of trust with your patients that you're really able to see a side that they show maybe no one else in the world. And having that kind of relationship, I think really, and I'm someone who just honestly loves customer service. I could have probably gone into any customer service job, and I think doctors are glorified customer service jobs, and being good at that level of relating with people and allowing them the space to feel comfortable is what really inspired me in medicine, and just, I think, ended up being my path.
Thank you. Deb?
Sure. So my path into the medicine and sciences was, to be honest, more practical than anything else. I knew that I was a child of immigrants, as I'm sure probably all of us are, and I really wanted something stable, and I wanted to put myself in a position where I wouldn't have to rely on anyone, that I would always be able to stand on my feet. And my sister actually graduated college in 2003, and she really helped me guide my decision, because I feel like even more so back then, there were less resources for Indo-Caribbean women and what to do, especially in the New York City public health school system back then. And, she really focused me in on, like, no, you want to pick a direct major. You don't want something that may not lead you in a path. So that's sort of how I kind of fell into pharmacy. And I would say what kind of led me into the path I am now in terms of being in oncology, which is arguably one of the most complex disease states, is just watching the complexities of people's medications and managing medications and dealing with insurance companies, and especially within marginalized communities, and the lack of resources and the very, very high copays really pushed me to get into that oncology field.
Wow, that was a range of answers. It's interesting to see that your inspiration, or the reason why you've gone into this, that has sort of changed as you've moved further in your career for some of you, right? Really interesting answers. So thank you, ladies. So we'll move on to our next question, and that is, can you share your educational background and how that's prepared you for your career path?
I can start off. This might be a lengthy one. Educational background. So my bachelor's is in pre-professional anthropology with a focus on the evolution of infectious diseases and epidemiology. After that, I did a post-bac program to prepare me for medical school. I did 2 years of medical school, and then I also have my master's in health sciences. How has this prepared me for my career path? So my career path has changed a lot. Initially, the focus was being patient-facing, being that clinician in the hospitals, working in a clinical environment. But as life evolved, my path also evolved. And then I still had that passion for medicine and sciences. So I found a way that I can take that passion and apply it to a educational background, because I still wanted to help a lot of people, help medical students, help physicians. And instead of being in that clinical realm, I'm now on the back end of it.
Shakti, you can go next.
Yeah, so I also had a bit of a meandering path, but in terms of educational background, I have a bachelor's in biology from NYU. And then I kind of went off into actually working for a while. So it's not, I guess, the traditional educational background, but I will say it definitely helps to have that experience going into research or academic research.
Gurdeep?
So after high school, I received an honor Bachelor's of Science degree from the University of Toronto. My formal education in psych with a minor in bio and women and gender studies allowed me to build a strong foundational skill set in like critical thinking, problem solving, communication. So more so with this, you kind of learn the basics of how to study material for testing purposes, whether that be your MCAT or your medical school exams. And then after that, I did a post-bac for one to prepare for med school. I did 4 years of med school, and now I'm preparing to hopefully apply for residency soon.
And I can go next. So I basically am from Queens. I went to high school in Manhattan. Then I went to NYU for my undergrad as well, actually, and I was in the College of Arts and Sciences, but I majored in psychology with a minor in drama. So I didn't really take the very traditional sciences path towards medicine, which was something great about NYU for people that might be in high school or might be in college. I definitely recommend it. I love that I have a foundation in majors that I don't really get to do as much now, and that I had those years where I got to really focus on that, and as well as do my pre-med classes. Then I went to medical school in Stony Brook in Long Island. And like I mentioned previously, I just started my residency now here at NYU. I personally chose not to do gap years, so I've gone straight through for each one.
Deb?
So I actually did a straight 1 to 6 professional doctorate program. So I applied directly into pharmacy school straight out of high school. So I entered into that program and then graduated in 6 years with a PharmD, which is a doctorate of pharmacy. I'm actually currently in school to get my MBA. So I'm crossing my fingers. Hopefully within the next couple of months or so, I'll be able to complete that. And the way I find that my MBA is going to help me in my career is, unfortunately, healthcare is a business, and sometimes it could be understanding that business side of it with that MBA helps you understand like why certain decisions are made. Because as a clinician, you're like, that's not the decision I would make. Why are we doing this? But when you have that background in an MBA, you know, you kind of get the big picture of it.
Wow, I can say those are very diverse educational backgrounds for where you are all right now, and definitely seeing that you can decide to go into it later on, and I guess the path is not always so black and white, right? So we'll move on to our next question. What was your first job in your field, and how did it contribute to your professional development?
My first job in the field was as an emergency department technician. So it was working very closely with the nurses, and it was in what's now New York Presbyterian of Queens, which was one of the trauma centers for New York City. So it was a very packed, very busy emergency room. And like Meha mentioned, you're facing these patients in very intimate situations. And from that role, it not only contributed to my professional development, but personal development, because you can always think of yourself as being very empathetic. That's where we're going into medicine and sciences. But it's being with those patients in that intimate setting that actually makes you have that empathy, make you grow personal, have that interpersonal connections with them, working on your communication skills, everything a customer service specialist would be. You know, it's hospitality, how you work, like, what can you offer them, make them feel better, make them comfortable. And I felt like that is very vital to just being in medicine and sciences as a whole. You have to have that connection part as well as that intellectual part, and then meshing the two of them together.
Yeah, so my first job was a research technician in an academic laboratory, actually at my current institution, which is Weill Cornell. So that really opened my eyes to, you know, when you're maybe in school, you learn about science from a textbook, but from these sorts of positions, you learn like what actually goes into forming those theories and the work behind it and the techniques behind it. And it can be also a way of exploring what field you may potentially want to study. If you choose to continue in academic research, I pretty much continued to stay in academic research until I started my PhD. So I think it taught me a lot about academia as a whole, and also other career paths within science. Like there are also a lot of related like clinical research going on, because I work with MD PhDs as well, and MDs that also choose to do research. So it's actually a very interesting way to also see another side of medicine if your laboratory works on that. But yeah, I would say definitely after college, I worked first as a technician, sort of learned the ropes.
I can go next. So if you choose to pursue a career in medicine, as you know, it's like a long-term commitment to learning. And with that, you could pursue a teaching role as well. So my first job was more so a role as a tutor for elementary and high school students, focusing on the science subjects. And it helped me develop a better understanding of the different types of learning styles that are out there and how you could use those for yourself to better grasp and a better understanding of like medical and science concepts. So I think like if your focus is more on the academics of medicine and science, you could explore your institution that you're affiliated with, whether that's college or university, because most often they have like TA positions, mentor positions, or academic scholar positions that you could go for.
Yeah, so something interesting, I guess, about my first jobs are probably that I've worked a job probably since I was 14, 15, but none of the things that have ever made me money have been in the healthcare industry, which I think says a lot about the way that we built the system for students, for people pursuing this path. There's a lot that you have to do to get into these schools. And of course, all of my volunteer positions, research positions, things like that. They're unfortunately always unpaid. So that means that a lot of the jobs that actually help you make money and so that help you kind of like pay the bills are kind of expected to be done on top of the jobs that you're already doing. But in that kind of vein of my healthcare related things, it's interesting, Shakti, like I actually did research, of course, as you need to do to apply to med school as well. And it taught me that I didn't want to be in the lab or behind the scenes. And I think that's why it's so important to do these kind of things as early as you can, to do those scribe positions, do the EMT positions, do the lab positions, and really see like where you fit, because there are so many more options than kind of what has been sold to us. But I would also recommend, especially, I can't speak for the other industries, but at least in the path of becoming a physician, that you do keep your jobs fun as well. Like I've done a lot of really fun jobs, and I think I knew that I would be doing medicine for the rest of my life, and giving tours on campus and being an RA and, doing things like that have created so much fun in my life. And I think that's something that serves you really well, even when now I'm a resident and I work like 80 to 90 hours a week. And you don't really have that luxury as much in some of the years of training. So I think there's a good balance needed in between, but.
All right, so I'll go. And that's interesting, because I was actually ready to talk about my first job being, my first paid job, but you just jogged my memory that when my first 2 years of being in school, I had a really hard time getting my foot in the door in what, most pharmacy students, we get pharmacy technician jobs or pharmacy intern jobs. And it was really, really challenging. So my first experience, professional experience outside of school was actually, I was volunteering at a hospital. And I didn't like it. It was pretty boring. You just kind of, you can say that it was your, for those in medicine who work in a hospital, it was that quintessential basement pharmacist where you don't see them and you just see the drugs magically appear. It was definitely that type of setting. So I was like, no, I don't want to do hospital from that. My first paid job though was working as a Walgreens intern. And I started that in my 3rd year of school. One thing I do want to highlight though, and I guess I'll kind of stick it in here, is that, throughout school, what I learned is that there are so many different roles for pharmacists, and it's not just dispensing roles. It's not just dispensing roles in a retail pharmacy like Walgreens or dispensing out of a creepy hospital basement. There are so many different pathways that you can be for a pharmacist. There's even residencies, and I feel like that's not necessarily as known as like, providers or nursing, that there are these residencies for you to become more clinical. So it's just something I want to throw out there, that you could become a medication specialist and never dispense a medication in your life.
Wow, thank you for that. I actually didn't know that at all. It's interesting how when you're describing each one of your roles and your paths, how different they are. I'm definitely learning so much from all of you. We do have a question, and this I'm gonna just throw it out to everyone on the panel. So Rahana, she's looking to become a doctor or a nurse. She did say it's very demanding. Is there a medical area that is less demanding and may offer a little bit more free time? If anybody wants to answer, or maybe I will kind of answer that.
Go
Oh,
ahead. No, go
sorry.
ahead.
No, I was going to say this is, I mean, it's not really like for me to speak on because I'm not this position. But when I was, I didn't really mention it either because wasn't the first job related to what I do now. But I actually did work as like a medical assistant and receptionist for a while, and I got EMT certified, which was more volunteer, I guess. But I was considering the medical field, and I was looking into what's called a physician assistant. And I know I don't know what their schedules are like, so I think everything in medicine is quite demanding, honestly. So it's always going to be kind of an interestingly tough position, but in my opinion, also not in medicine though, but it's less years of schooling, as I understand. So just a suggestion if anyone else can comment more on that.
So yeah, like then Shakti, that's a great point that you brought up physician assistants, because even though again there's less years of schooling, you can still specialize as much as you want. There's still residencies for physician assistants. A good friend of mine is actually a first assist cardiac thoracic physician assistant. So she does the cardiac surgeries in with the doctors, with the surgeons as a first assist. So it's and her compared to like somebody that works in an outpatient, let's say an urgent care setting, that job is very stressful. So what I will say to answer that question overall is that, I can't say that there is a non-demanding medicine, at least a practicing clinician job. I have friends who are EMTs, I have friends that are CNAs, I have friends that are nurses, I have friends that are physicians. What I will say that across the board, I will say it's very stressful. What I can say is that there's certain fields and certain areas and certain departments which can be less demanding. I think a good highlight is like perhaps working in like a peds urgent care where you have set hours 8 to 4, no call. Call meaning that like you're not having to answer your cell phone in the middle of the night, versus let's say somebody that's an OBGYN or a cardiologist where you are going to be on call 24/7, 3 a.m., get out of bed. So I think like there's more like a range of a spectrum versus, like there's a range of a spectrum depending on what you choose to specialize in.
Yeah, I think on that note, I think this is an incredible question for you to have and really great for you to be thinking about it before you enter the field. I don't think it was talked about enough actually when I was applying, and I think there's, post-COVID in the world and the entire workplace, this kind of shift where people are starting to care more about lifestyle and realize how important lifestyle is. And there are a lot of options for you if you are interested in healthcare to create the life that you want. And I will say that even as a physician, it is what you make of it. The years are hard in the beginning. And I personally haven't made it to attending time yet, so I can't speak on the like light at the end of the tunnel that everyone speaks about. But I had to make that decision soon too. I was actually literally applying to surgery into OBGYN. I was going to literally do GYN surgery. I was at the door, and it really took me reevaluating the kind of life that I want and the kind of future that I want. And like Deb mentioned, there's different and different specialties. So I the fact that I'm doing internal medicine right now, I love my program. I am at this panel because I got out of work at 6:15 today, right? And that is usually when I was, for months, I did OBGYN, and that's not the reality. That's really not something that you see. And of course, most days I get out of 8. I'm not trying to glorify medicine, right? This is something that's hard, and this is something you have to know about. Less demand. I have a lot of friends that went into dental school instead. And I think that's a great option as well for people that love healthcare, but want that really structured 9 to 5. Vet school as well is very fun. And if that's something that you're interested in, it has more structure. PA school is incredible. Most PAs can work 3 days full time in a lot of the specialties that you choose, and that goes with nursing as well. But I think what a lot of people were mentioning about demanding is because of the emotional stress that healthcare has. So a lot of times we might actually work, like nursing and PAs that are working 36 hours a week might physically be working less, but there's a lot of stress that comes with that. But it's really what you make of it. One of my friends is a nurse working at a fertility clinic, and it's just like a lot happier, a lot more, different things. So it is what you choose, I would say. And tech jobs are incredible. The only thing I think, if you have to ask like what work you like to do, because even if PAs and NP jobs might have less hours, I know I personally couldn't, like, being a resident is extremely hard, and unfortunately they have to do resident jobs for a long time. And for me, it's worth doing the resident job maybe at double hours right now, knowing that in the future I'm not. So it's like you have to also see what is the work you like to do, because you could have the best schedule and hate it, and the worst schedule, even the nights where I was, basically sleeping 4 hours, going from surgery to surgery and like enjoying it. So it really is, you have to like what you do regardless of the hours, I'd say, in medicine.
Yeah, I think you brought up you kind of jogged my memory there too, because I have seen some nurses, they go through the very vigorous program. And I've also heard of physicians who do this as well. They go through it and then they don't ever practice as clinicians. So that is an option as well. You can become a nurse and do admin. So you could still get a degree in a field and still be very much involved in healthcare and then never be a clinician. For example, there's pharmacists and all they do is like medical information at an industry. They write like the package inserts, they do advertisements. So you could get your degree and kind of pivot into something else.
Thank you so much. I also agree. That was a great question. As you are deciding whether or not to go into medicine and sciences. So thank you, Rahana. It sounds like you have been thinking about it, and definitely more exploration. And as part of the panelists, since we are part of South Queens Women's March, you can also chat with them privately about this. So thank you again. This I would like to lead into one of the other questions that I was planning on asking further down, but I think it's a nice transition into it in terms of how do you all handle this work-life balance within your industry, given the demanding nature, right, of this role, of your roles.
Yeah. I think work-life balance in any aspect is really coming down to what your personal priorities are. Is your priority like idling and enjoying your cup of coffee in the morning? So you're going to sit out that hour in your day to enjoy your cup of coffee? Or is your priority, having a brunch date with your friends? So work-life balance is really just what you make of it and how you make your priorities. You really have to have a strong list of things that are really important to you, and then seek out the time to then do those things. Because you can be busy with a lot of things. A lot of things are going to pull you in a lot of directions. But if you're not set on what's really important to you, you'll never have the time for anything in any regard.
I guess I can go next. Yeah, that was worded so beautifully. I would say my career, and I'm kind of still figuring it out, figuring things out, so forgive me if I'm not super clear, but it's like for science, it's not, there's not a patient, there's not like I would say as that like critical stress as much, but for me, since I'm in a degree that's very unknown, it's sort of like your schedule is what you make it, also depending on what laboratory you're in, but also your progress is what you make it. So you have to, I think Christina put it very well, that like you have to sort of determine what's important to you and sort of dictate your schedule accordingly and what you want to accomplish accordingly. There are still benchmarks, of course, within my degree where I have to qualify for my degree. I have to present a proposal. So these things are definitely like set in stone. But everything else, like my day-to-day, it's really the progress that you want to make and how much you're motivated to do it. And also you're at the forefront of knowledge, sort of. Like, I hope that doesn't sound too dramatic, but so a lot of what you're doing is completely unknown. So yeah, it's kind of like what do you value? And like if you want to stay late in the lab, get an experiment done because you want to know something, or if you have a family and you want a sort of different schedule for yourself, like you can do all of that. It's very possible, but then you have to set those parameters for yourself, find the right environment for it, and yeah, essentially know what you need.
I think Christina and Shakti did a great job of kind of answering that question. And so I think when it comes to work-life balance, it does really depend on what you want to prioritize for your schedule. So specifically what helped me was like giving myself allocated time, whether that's a day of the week, an evening, or even weekends, to kind of spend that with my family or friends or whoever, I want to spend that time with. Another thing that could help is like pursuing an activity or a hobby outside the field of medicine and science that you enjoy. And so it essentially does come down to what you prioritize and how you allocate your time, how you want to schedule things.
Yeah, I think it's great to see how many people have like been really able to find their work-life balance in like different ways. And I think in medicine, it's really hard because we're fed this idea that we have like medicine has to be number one all the time. And especially with how competitive the cycles have gotten and everything, like it's totally understandable, as a pre-med or in college when it's so hard for you to not. But I just think life is so meant to be lived, and medicine is all about delayed gratification. You're constantly thinking about the next test or the next application or the next job. Like it's always you waiting for that next step, and it's so easy to get into it. And I've seen so many friends like really, really struggle with that because it's so easy to get wrapped up into. And my fiance is an orthopedic surgery resident, so he's working 24-hour shifts all the time. And when I started working my first 24-hour shifts, and I was just like constantly just wanted to like come home and sleep all day. And I remember he told me that it's better to do things tired than not at all. And I've never forgotten that. And I really think that in medicine, especially in like your training years, it can be really difficult, but it's sometimes not even about what you want. It's like, just do it. Go out, make the plans, try to see people, try to have fun. And once you're there, I promise it'll feel so much better. And it's unfortunate. I think there's a lot of problems with the medical industry. I think that's a whole different conversation to be had, that, I think this is one of the best jobs in the world. It'd be great if it could be a 9 to 5. I don't know why it's not, but regardless, even with what you're given, I think it's so important to have so much fun, and it would just be impossible if you didn't. So I think regardless of what you want, regardless of how tired you are, regardless of how much you want to stay in, I would say prioritize that. Again, this is easier said than done. I think I've lost a lot of hobbies over the past few years, unfortunately, but there have been times like even South Queens Women's March, and people around you, Aminta, shout out to her, like understanding when there's phases in your life when your job has to be the priority, and then phases when you could be working nonstop on the things that you love and nonprofit work and your hobbies and your friends, and letting the balls drop one way or the other, different weeks, different months, and letting that evolve, letting that priority keep changing, I think is super important.
Yeah. So I'll go next. And I really just want to say I do think as well that it's unfortunate. And I have seen a lot of strides taken in my almost 20 plus years since I've been in school about, where the field of medicine has gone in terms of work-life balance. I feel like when I first started my profession in the early 2000s, it was not heard about what a work-life balance was. So I think we have taken big steps, but there is a lot of room there. So I'm just going to go with talk about my personal experience with work-life balance. So my first job as a pharmacist was working in retail pharmacy. And there was no work-life balance. Your hours did not allow for a work-life balance. You would be stuck there for 12 hours long, 13, 14 hours. No time to sit, no time to eat. It was really, really challenging. I will say that where I'm at right now as an oncology pharmacist, there's definitely a much better work-life balance there. I have for the most part, very set schedule of 8 to 4. That's it. So I guess to kind of reiterate what I'd said previously, it kind of depends like what job you're doing, and then also what's been alluded to before, what's important to you. So for me, I got to a point where I can say that I experienced burnout. And what that kind of triggered for me was I need to leave this job and I need to get something better, or I need to get out of that area. So, right now I have a set schedule, but, I'm also in school getting my MBA. So right now, what kind of works for me is, I actually have to plan out like my weeks, like, okay, this time slot is going to be dedicated for South Queens Women's March. This is important to me, and I'm going to make the time for this no matter what I have going on and in my life at this point. Okay, this date I'm going out to see my friend, and that's it. And I'm not going to change on that commitment, regardless of all these other responsibilities. If the house doesn't get clean today, the house doesn't get clean today, because you have to schedule in those little breaks for yourself. That's what I find works.
Thank you so much. So as I've mentioned, I'm an HR professional and I could probably talk about work-life balance all day long. But great answers, really. It's just sounding like each of us has to define what work-life balance means for each one of us. Coming from in my field, I've heard for many years that work-life balance is doing everything as a woman, right? Being able to prioritize everything and do everything and be everything, right? And sometimes, as some of you have said, sometimes you can't do that. We have to just prioritize and have fun and live, and also just be able to be present. So thank you all. Those answers really resonated with me in my field as well. Lots of similarities here. So we're going to go on to our next question. So how do you balance your personal values and beliefs with the goals and missions of the organizations that you work for?
I can start that off. I would say that, in previous jobs that I've had that where their goals and missions did not align with my core beliefs, it was challenging. I really struggled there. So right now, I work for New York Presbyterian, and I'm really, really happy that I feel, at least in my experience, I feel that their mission and their goals much more closely align with my own personal values. But I will say that I know sometimes it's tempting to just be like, oh, this is a job, let me go get this job. And that can be really hard. So, just to look at it and say, is this over time going to be like a good fit for you. Like, for example, if you're somebody who really strongly supports abortion rights, perhaps working for a Catholic institution may not be the best place for you. So, those are certain things to look out for, as you pursue your career.
You can go ahead. I just needed a few seconds to think. That was a very deep question. I think it's also like that work-life balance of like trying to balance how you feel, disassociating your emotions from your job and the work that needs to get done, because there can be a lot of sectors where you're not agreeing with a lot of things. Maybe in a patient-facing position, you're not agreeing with certain policies in the hospital you're working with, how they're treating patients, how they're diagnosing patients, etc. For me in medical education, there's a lot of things that I don't necessarily agree with. I feel like in medical education, they can expand more on why in Black and Brown communities, maternal health is not a priority, or why in medical education textbooks, why are people of color not on the forefront to show certain dermatology diagnoses. But staying true to the mission and knowing that you're in this field, yeah, you're working in it, but you came in it to create a change. That's how I always see it. I'm in this position because I wanted to create a change and working towards that goal.
Yeah, I can go next. I think this is a really interesting question because a lot of us mentioned how we like came into this to help people and save people. And I'm sure all of us can attest to like times when you were watching things that you just didn't like how they were going. And I think it's really important to choose really carefully the institutions you want to work at. And I'm at NYU right now, and I'm basically, we have a two major hospital system. So there's NYU Langone and NYU Bellevue, and they're on the same block. And NYU Langone, Tish, is basically what you would imagine of any uppercut New York City, Manhattan hospital. And it's truly phenomenal healthcare. The kind of like new innovations and like research and healthcare that's being provided there, incredible. And then right down the block, you have NYU Bellevue. Bellevue is the first ever hospital made in the country. So it's been around so long, and it's what we call an HHS. So it is like a city hospital. And the kind of satisfaction and love and just compassion you get out of working at Bellevue, I think is incredible. I don't think I've had a single patient who has insurance. Most of them don't speak English. They are provided entirely free healthcare. A lot of the attendings that work there take large pay cuts to be there. These are incredibly high professionals who have studied all around the world, who come to Bellevue and essentially work because they believe in the mission of that hospital and of being one of the first open door policy hospitals in the nation. So I think it gives me a really quick kind of understanding of like how two very different systems work. And I'm very lucky to get that just in training. But I think going forward, this is the things I'm going to really be thinking about strongly when I'm choosing my future jobs and clinics and private practices and all of that, because unfortunately, this is the way medicine has been made. And we have the ability to be the practitioners who really make it better rather than be a part of kind of this cycle that has been started in the medical field. So I think I would really recommend like doing really full research of like the jobs you apply to, the institutions you want to work for, because you want to be able to wake up and feel really happy with the work that you've done. So yeah, but I definitely think it's possible to find a way to make your values work with this job, especially medicine, which is inherently supposed to be good. So
I also think like my strategy to balance my personal values and beliefs with the goals and missions of organizations that I work with is to find a common ground by seeking areas of overlap and alignment. So definitely go out, look at these organizations, look at what they stand for, look at their mission, and actually see if it aligns with your values and your beliefs. But in medicine, it's also important to be open-minded and respect opinions and beliefs of others. But essentially, if you're putting in so many hours, if you're putting in so much effort, I feel like it's very, very important to find something that aligns with your beliefs.
Thank you for that. So moving on to the next question. I also just wanted to point out, Damien and Hall, you've mentioned sort of the path in various medical areas, and I just wanted to let our audience know that they can go ahead and read that. But I really love the bottom of that, where he says the best advice is to follow your passion and enjoy what you do, right? So that's sort of one of our themes tonight. And so with that, we'll go on to the next question, which is, can you tell us a little bit about how you stay motivated and committed in your fields?
All right, I'll hop into this first. I think for me, you know, like just falling into oncology and really finding something that I'm really a specialty that I'm very, very passionate about. Ever since I found this field, I find that I don't have to force myself to be motivated. I'm motivated waking up every day. And I know that sounds really cheesy. And I almost can't believe I'm saying that. Because, but it's true. And so again, you know, like the panelists have alluded to before, just as important about deciding what profession you want to be in, it's finding what you want to do in that profession. Because I know so many healthcare professionals that maybe not enjoy their jobs, or they feel that burnout really high. So I think it's really important that you kind of find something that you really want to do within that field.
We can go next. I think the motivation comes from the satisfaction you have either working with a patient or working with an individual day to day. For clinicians and physicians, you guys can speak on this, but I guess when you finish working with a patient and they're just like, they're thankful and they're smile on their face for you helping them. For me in medical education, it's not so much in that clinical setting, but it's still working with medical students on a day-to-day basis, working with physicians, working with institutional leaders, and them being excited about what you have to offer and how it can help them, how it can help their students, how it can help medicine in general. So that's what keeps me motivated personally.
Yeah, for me, this kind of connects to the previous question. So for me, one of the personal values is like, I really want to be in a field where I can continue to learn. And that's part of my motivation to be here. It's part of the motivation of a lot of the people around me. It creates a kind of environment where everyone is kind of pushing towards something. So that also helps me stay motivated. So I think I've found like my personal values align with this environment, and that also helps me stay motivated. But also, I think I guess I'm a student. This is not my job anymore, but it's important to also not make this everything. Like others were saying, like you have to get out, you have to do things, you have to have other things outside of it, because failure is inevitable, at least in research. And you have to be able to accept that and move on from it. So I think one of the ways I stay motivated is making sure that, like others have mentioned, seeing friends, seeing family, finding things outside of it that keep you centered in who you are and like what you can do and what you can accomplish even outside of work. so that, as someone mentioned before, as one ball drops, like you have other things going on.
Yeah, I think it's really important to see kind of the big picture in medicine, because I'm not going to lie, I have to ask myself this question every single day. And there's been times in, during med school and during residency where it sucks, and that's fine. I think it took me to a point where it was fine for me to be like, okay, this week sucks, and that's okay. And it doesn't have to be good. And this doesn't have to be like roses and daisies all the time. And that's fine too. But I really think the only thing that, especially at my age where I basically just started making money, I honestly don't really even think I have a job yet. Like, medicine has never felt like a job. It's something so all consuming. And so, in the student realm, that you never fully feel that way, I think, for a long time. And having so many friends in the same age group who are making such good money and working really good hours and kind of enjoying their life outside, it is such a natural feeling to be asking yourself, like, why am I doing this? And that's totally fine if you're in a place where you're feeling burned out or asking those questions. And I think the only thing, especially at this time in residency, is me thinking about when I'm dying, honestly, because our jobs are, the majority of our lives are spent in our jobs. And I want to know that when I look back, the majority of my time was doing something that was good. And, it's really like, even today, I gave a patient pretty bad news and she came back with a bushel of bananas for me. I don't know why bananas, but it was so cute, right? The job is not good. I didn't give anything helpful. I did not do something, I've held hands with families and delivered extremely painful news. So it's not good in the sense where I'm like able to save everyone and heal everyone, but like, I'm going to look back and know that I might have been working 12, 16 hours, but like almost every single one of those hours, I did something that I can be really proud of and feel really good about. And I think that's one of the only things that keeps you going when those times get tough. So, but easier said than done. You kind of have to remind yourself that every day, but that's okay too. I'm just going to keep doing it over and over again.
I completely resonate with what Meher said. I think all days aren't going to be roses. You're going to have difficult days. You're going to have times when you really question why you're doing this. But I think it kind of comes down to having a strong motivation to enter this field and having a strong reason as to why you want to do this, because it's a big commitment. You're going to be spending several hours of the day studying, or several hours of the day like helping people, patients, kind of doing that customer service type of job. But if you kind of remember why you started, looking at the big picture and knowing that you're doing something good at the end of the day, I think that's what helps me keep motivated and committed to the field.
Wow, thank you guys so much. So we are winding down. We have a few more minutes. I would like to ask one last question, and it's the question, what was the best advice that you've received thus far?
For me, it's staying true to the passion, but allowing the passion to lead you in different directions. So this resonates a lot with me. My path was very linear, as in I was going to be a physician. That was everything I was working towards was going to be towards that path. But life throws you curveballs. You reevaluate your priorities in life, and things change, and you have to learn how to pivot with it. And I think me still being able to stay in the medical and science field, but learning where I can maneuver and where I can now use the skills I've gained and where my life has taken me now and pivot into a new direction. So I'm staying true to the passion, but you also have to allow yourself to move around a bit, because it's not a straight or linear path for anyone. So allowing yourself and knowing that it's okay that if you deviate a little from the path.
You know, I can't think off the top of my head the best advice that was given to me, but I really enjoy what Christina said. I will say some of the best clinicians I have ever met have been people who did not follow that linear path, people who went to you know, and went to like another year of school or got another degree in between, got a master's degree in between becoming a doctor or whatever clinician they wanted. Individuals that went to the army before becoming nurses. I think that those life experiences before you get your terminal degree are not valued enough and are not talked about enough in high school. You know, I feel like in high school, even in your early college years, it's always like, okay, you got to stay on this path. You have to, how are you going to get the best MCAT score? You know, and that's not what makes you the best doctor or the best any clinician. It's really those life experiences and how you translate those life experiences into patient care. So I just want to highlight that, you know, that even if you know you want to be a doctor, a physician, and you know you're right now your grades don't cut it, you don't have to turn away. You know, I actually, unfortunately, I know quite a few individuals who were told by, you know, I guess like their career counselors in college, like, listen, you're not cut out for this. Don't, you need to look someplace else. And they didn't give up, you know, and they're caring, compassionate, dedicated individuals. So that's something I'd like to put out into the world, that just because you get told no and people are telling you no, don't listen to them. And just because everybody else is following that path doesn't mean you have to follow a linear path.
I 100% agree with that and support it. And also, I would just like to add, one of the things that I don't know if someone specifically said it to me, but it's become apparent in my own experience, is never be afraid to ask for information. Never be afraid to contact someone, ask for an informational interview about a job, about like if you want to be a med student, to contact a med student, say, can I just talk to you? Can I buy you a coffee? Just to ask more about your experience, to gain information. When I was applying to graduate school, I was the first person I knew applying to graduate school. So it's like I had to ask other graduate students. Luckily, I was in an academic setting and I could find these people, but I also had to reach out to a lot of other people for information. And even I feel like when you're in high school, like a lot of maybe these things are not taught, but like you can reach out to professors. You can be like, hey, I find your research really interesting. Can I maybe come by your lab or maybe volunteer for a summer? I know not everyone has that capability. And financially it could be a concern, but there are a lot of summer programs. And I hope I'm trying to remember the name of the program that's specifically through Weill Cornell, and I forgot. I apologize for that. But there are programs and there are a lot of opportunities to be had just by asking for information.
So I really like what everybody said. Great advice. I'm just gonna keep it short and simple. But the best advice that I received is work hard, pursue your dreams, but don't ever compare yourself to others, because everybody, they don't have the same path. Your journey is unique to yourself. So somebody may be taking a linear path to be a physician or a nurse, but there's so many different fields, there's so many different career paths within medicine and science, and it just takes a little bit of exploring and figuring out what really resonates with you and pursuing that, you know.
Yeah, I really love that. I think that's such an important thing. I think in any field, but especially in medicine where there's so much competition like forced upon you, even when there doesn't need to be. And Damien, I really like I was about to say something kind of like that, where it's not about the destination, about the journey. And when the journey is so long, it's so easy to get bogged down in it. And I think passion is really weaponized in this industry. Your passion is supposed to mean you don't need sleep and don't need hobbies and don't need friends and don't need money. And it's really weaponized and you can't kind of let it be. I think you have to fill up your days and set really, really clear boundaries. And I think that was one of the best advice that I gotten, is that this is not supposed to be everything. You are not supposed to get all of your validation from academics, which I think for people in medicine, we just train ourselves in a way to be so surrounded by like that constant need for academic validation. I think when you're able to fill your life up with all of the other stuff and realize that the only important thing is the relationships you have and the people that love you and the people that care about you and who you can be to them, I think you show up as a better doctor for your patients. I think you show up more rejuvenated and better off than anybody who's making their whole life about studying or constantly, and it's hard to turn those boundaries. There's sometimes when I'm like sleeping and I'll wake up thinking about one of my patients. Like, it's hard to leave work at work, but you need to, so you can enjoy every single day, and not just keep waiting for the weekend or for you to graduate or for you to become an attending. Like, really enjoy every single day because you've made your life so full. Yeah.
That's wonderful. I think that ended our session on such a great note with your advice for our participants this evening. Some key takeaways for me were research, research, research. You can pave the way and drive change. Find your passion, but be flexible in them. Understanding what the misconceptions of this field are, and sort of I really commend all of you for sort of breaking down some of those barriers for yourselves and really paving the way for others. um, and then just asking for information, which I thought was so valuable. So I really want to just say thank you all for making the wonderful contributions in your respective areas and for joining us tonight. I know you're all very, very busy and in your roles, and just making the time to speak to us and shed some more insights into your areas, this area of medicine and sciences. And thank you to our participants for joining us as well. We do have a few more minutes. I think lots was covered, but if anyone does have any comments or questions, we can definitely put them in the chat. We can, if there was anything else in particular that we didn't speak on, we can definitely do that. So, but we have sort of wrapped up tonight's mentorship session for medicine and sciences. Just giving it a few more minutes. Okay, looks like there are no more questions, ladies. Thank you so much for everyone for joining us, participants and our panelists. Have a wonderful rest of your evening, and thank you again. Good night.